On today's podcast, we're talking about work hardening and what it is and how it can play an important role in returning injured employees back to work.
Retain Ohio is funded by the U.S. Department of Labor and the Social Security Administration under a grant award to the Ohio Department of Job and Family Services. 100% of grant funding is from U.S. federal funds. The RETAINCares podcast does not necessarily reflect the views or policies of the U.S. Department of Labor or the Social Security Administration, nor does mention of trade names, commercial product, or organizations imply endorsement by the U.S. government.
Hello everyone, and welcome to another edition of RETAINCares, Safekeeping Employee Health. I'm Dina Zidian. I am your Referral and Enrollment Supervisor for Retain Ohio.
Hi everybody, this is Christina Feathers. I'm the Education and Training Supervisor for Retain Ohio. Welcome to this month's episode. Dina, could you tell me a little bit about what work hardening exactly is?
So work hardening is a specific therapy program for those employees that are injured and cannot return to work at full capacity. It incorporates the following care team members. You need your provider, your physical therapist, and of course your employer. With approximately 1/3 of all injuries in the U.S. being work-related and 50% resulting in employees taking time off work, having creative return-to-work strategies in place can be beneficial to both employees and employers.
Wow, yeah, and I know that work disability is a huge major personal, financial, and public health burden.
It is. The National Safety Council estimated that it can cost an estimated $119.4 billion for these injuries and illnesses that an employee can have happen to them at work or off the job.
Yeah, so we took a look at a bunch of studies that assess workers with mental health, cardiovascular conditions, patients that have experienced a stroke, cancer, patients with MS, and other non-specified health conditions. There was a lot of factors assessed, but very few were consistent across all of the conditions. So this is what Retain is taking a look at, and this is what we are assessing. We're taking all of the current conditions, and we're seeing if our return to work strategies assist, rather than taking a look at what strategies will assist people with specific conditions. We look at all conditions. So a lot of common factors associated with a positive return to work are higher education, socioeconomic status, higher self-efficacy, and optimistic expectations for returning to work. And then there are lower severity conditions also that help patients return to work faster, such as instead of somebody having maybe multiple broken bones, they might just have one broken bone. So, Dina, a lot of these factors will help patients get back to work faster, but do you want to help me remember what will keep somebody from getting back to work as fast?
I think you hit the nail on the head when you said about being optimistic. I think that the better positive attitude you have about getting back to work, that always plays an important role in returning to work. If you do have a negative way of looking at things, like I'm just not going to get better, or I'm going to get lost when I get back to work because I'm so far behind because of this injury, that stress can play a really big role in how your success goes in returning to work.
Yeah, and there are a lot of common factors that are associated with a negative return to work also, such as a person's age, a person's gender, the perceived amount of pain that they're feeling. Also, if their job requires higher physical demands versus maybe a more sedentary job, those will all limit the amount of time it takes for a patient to return to work.
So work hardening is actually one of the strategies that people can utilize to help these employees, as we said earlier, in returning to work a little bit sooner and a little bit safer than they may have been without that strategy. So it starts with your provider and Retain. And do you want to go into detail more about what the family physician can do?
An individual's PCP or even their specialists are important in the process of returning to work after a patient has had an injury or illness. So right off the bat, a physician has to gain an understanding of what the injured or ill patient job requirements are. So it's super important that the provider will maybe speak with the patient's employer, or they might ask the HR department or somebody in that realm what specific functions the patient must do. From there, they're able to take a look at perhaps a job analysis or evaluate the job itself that the patient is required to do. And based off of the limitations that a provider is going to put on the patient, they hopefully can work with the employer to provide workplace restrictions so that way the patient can maybe go back to work sooner but with less job requirements or maybe some work modifications.
Right, and a retained provider will begin the process by completing what we call an activity prescription form. This form asks the following questions that Christine and I are going to go over briefly, and it just helps the physician to assess where the patient is at as far as returning to work. So one of the first things that they ask themselves about the patient is, can that patient hear, speak, remember, understand, concentrate, interact, and adapt without limitations? A patient that possibly had some sort of head injury may be very forgetful, especially if they had a concussion. I know firsthand, my daughter was in a serious car accident several years back. She was thrown 25 feet from the car, and you would think with that injury in itself, glass cutting skin, her memory being jarred, not being able to swallow for some time, all those injuries, the worst injury was that concussion. She couldn't remember things that she should have been able to remember. I know I caught that something was off because when she was in the car accident, she had a birthday card for her sister, and her sister went back to the site and found the card and brought it to the hospital for her to sign it. And when she went to sign the card, she literally picked up the pen and held it like a toddler holding a crayon for the first time.
She couldn't remember
She
how
couldn't
she was
remember
supposed to
how to hold a simple pencil. So knowing a person can just speak clearly, remember what they should remember is super important when returning to work.
Yeah, and not only will providers, patients, and employers want to take a look at the mental aspect of it, but also the physical aspect. It's important that a provider understands the role of a patient at their job, so that way if a patient perhaps is working on the line for a long period of time, maybe they can come up with an adaptation where the patient might be able to take more breaks or sit down more often rather than standing that whole period of time if they maybe have an injury to their knee or their leg or something like that. And also vice versa, those standing desks, maybe if somebody needs to be up on their feet more often rather than sedentary. So these are all of the things that the retained providers will take a look at when they go over the patient's activity prescription form with them, and from there we're able to communicate these with the employer, patient, provider, whoever needs to know.
I know some of our enrolled employers have told me that one way they prevent injuries at work is by constantly rotating their staff. So if they have a position where they are kneeling down a lot or they're twisting, say they're stacking a shelf with boxes or something like that, they only let them stay at that position for 2 hours before they ask them to rotate and go to a position where they're sitting more. And I think that's really important because it shows that not only does everyone know everyone else's job task at hand, and that's beneficial when someone calls off work, but it gives your body a break and a chance to recuperate from doing that physical labor that you were just doing. With job demands, the provider needs to understand that job description also for that patient that they have before they return them to work and know what their job demands are. So do they ask the employer directly about this? Most of the time, a provider is not going to call the employer. You do have some, and I know we have heard of some providers actually that have called employers and asked, like, what exactly do they do there so I know if they should return yet or not. If the provider were to contact the employer directly, what questions would they ask? Would they know who to speak with? Does the employer have that job description ready to go to answer those providers' questions in full detail and know what is required to complete this person's job? So Retain actually helps with both of these questions, so the provider doesn't have to make that phone call to the employer, because that's what we do. Our health services coordinators speak to both the patient and the employer to understand the duties at hand. They can also view the provider's notes to make sure that they understand the full diagnoses and range of physical capabilities the employee is able to perform. So that's really important. And there is also our ergonomic team, as we had mentioned in the past, that can come in and assess the workstation to make sure that employee can return. I know, for example, there was a patient that broke her ankle. She worked at one of the doctor's offices, actually, that I have visited quite frequently in the past. And you would think she was checking patients in, she's charting, doing things like that. She really wouldn't need to have some sort of ergonomic device to get back to work. But because she also saw the patients to the exam rooms and was standing on her foot a lot more than you would think, she did need a scooter. So she had a scooter in place where she could just kind of wheel herself around a little bit quicker, not putting weight on her foot, and that way, it helped it to heal a little bit faster. So knowing the job description and what all is involved is really important for the provider to know and for the employer also.
Yeah, and the health service coordinator really is able to do that communication and take that additional work off of the provider's hand.
Right.
So there are 7 principles for a successful return to work. They have been previously established by the Institute of Work and Health. So the first principle is that the workplace has to have a strong commitment to health and safety. It's very important for every workplace to care about the safety and health of their employees across the board. The second is work accommodation, which we discussed earlier. The third is it is important to support the returning worker without disadvantaging coworkers and supervisor when the returning employee is coming back to work. It's super important that the other coworkers don't feel any type of way towards that coworker, especially if they are receiving a modification. So we want to go ahead and support everybody in their return to work process across the board. It's also very important that supervisors are trained in work disability prevention and included in all return to work planning. So if HR has approved an adaptation or a modification in the workplace, we have to make sure that it's communicated to the person's manager or direct supervisor. Otherwise, they'll be like, get back to work.
Right.
Maybe when the person was approved for an extra break or something like that. And then also the employer has to make early and considerate contact with the injured and ill worker to let them know that they are allowed to come back to work with modifications. So the employee might want to come back to work right away, but they might be like, oh, my job doesn't care. They don't want me there with a broken leg, so I'm going to be off even longer. Whereas if the employer is able to reach out to the employee, they might say, hey, whenever you're ready, we are willing to work with you and make a modification. We want to be here to support you in your recovery. And then number 6 is where we come in. We offer that return to work coordination across the board. So we can go ahead and coordinate all of this with the patient, the employer, and the provider. And then lastly, it's important that employers and healthcare providers communicate with each other about the workplace demands. And those guidelines are intended for all workplaces and return to work professionals. So number 6 and 7, Retain goes ahead and takes it off of your hands. We go ahead and handle all this coordination and make sure that you understand what your employee or patient needs to return to work safely.
Right. And I feel like it is important that the employers understand we're not trying to change the way you do things if you enroll in Retain also. We're just there to basically lend you an extra hand to help with certain things like this communication.
Yeah, we listen to what the
Christina's
other
talking about.
people need, like the employers need. What do you need from us to help you?
Right.
Not necessarily come in and say, this is what you
Right.
need to do. We want to hear from everybody else.
I would say almost 100% of problems can be solved if people would just communicate better.
Yeah, definitely.
So-
Communication's a key factor. So I'm glad that we have a program like this to increase that communication.
Absolutely.
In the past 7 months, Retain Ohio has enrolled over 700 patients from the Toledo, Cincinnati, and Youngstown regions. If you have been hurt outside of work and are experiencing a musculoskeletal injury or an acute cardiovascular event, contact Retain Ohio today. Give us a call at 1-833-4-RETAIN.
And the workplace restrictions that Christina was talking about. So knowing what those look like, according to the Dictionary of Occupational Titles for physical work, it's divided in 5 different ways. So first, of course, we have our sedentary workers. Those are the people that pretty much, maybe they work in a ticket booth and they don't do anything because they're confined to such a small space. They don't get up, they don't move around, they're just handing a ticket out the window, basically. Then you have your light duty workers. Those are people that actually I would classify like a secretary as a light duty worker, because she does possibly have to get up, shuffle things around, filing. She's not just sitting the whole day. A medium worker, I would say, is someone that has a mix of a little bit of physical work along with sedentary work. Possibly someone that is a supervisor that oversees many people, and they jump in to help when there is help asked from them. So a heavy worker is someone that is doing a lot of physical labor, possibly a construction worker. And then you have your very heavy laborers, which possibly could be someone like a coal miner that is strictly physical work. There is no, other way around it. So, and there are special equipment or ergonomic devices that can help with some of these things, like I had mentioned before about the scooter. But there's other types of equipment, or as Christina had talked about before, just taking more breaks during the day. That in itself can be a big part of recovery for them.
Yeah, and even offering a chair, maybe if somebody is able to sit for a period of time and do
Right.
their work rather than stand the whole time. Little things like that can make a huge difference in a person's recovery and offer an earlier
Right.
return to work. A productive return to work strategy is needed to minimize the consequences of occupational injuries and illnesses. Aggressive multidisciplinary rehabilitation programs and plans of care are shown to achieve higher return to work rates. These rates range from 50 to 88%. However, the longer the patients stay away from work, the less likely it is they will ever return.
And of course, here's my favorite statistic that I use in every single presentation. 50% of employees do not return to work after being off of work for 12 weeks. 100% do not return after being off for 1 year. So I think that in itself says a lot.
Yeah, it's so important that everybody involved in a patient's care after a patient is injured is on board with helping the patient return to work in a timely manner. So one option is for the physician to contact the patient's employer, which we've already said a lot of providers won't do that, but some of them do. At Retain, if a patient enrolls, we'll go ahead and handle that for everybody, so nobody has to do that. But many workplaces have occupational health clinics or a human resources office or something along those lines that we're able to get in contact with, and all of those departments are able to provide the physician with job qualification summaries, and some employers may have already performed a functional job demand analysis for the patient's position. But if not, like we said, we're able to come in and offer those ergonomic assessments.
Right. And one person in this strategy that the provider can speak with is the physical therapist. And that physical therapist can do what we call a functional capacity evaluation. Physical therapy, they usually will take that employee and see what task they can still do specific to the parameters of their job specification. So it sets the capabilities of that person, it sets limitations for that person. It can be costly to have done. We here at Retain are the ones that we don't perform a functional capacity evaluation. However, we still can assess the workplace and the workstation for that employee at least. So it's still helpful even if we can't do that full capacity evaluation. The physical therapist can also determine if this employee still needs some rehabilitation. If so, how much and how often is needed, and what will happen when that patient reaches maximum medical improvement but still not complete their duties. That is a question that has risen, I think, so many times in the past. But if the patient is unable to perform the job responsibilities that they once had, and their employer is unable to reasonably accommodate them, the patient in the performance of those tasks, at least he can't do those tasks any longer is what I'm saying, the patient may be declared unfit for this job by their employer. And if they don't have another role for that patient, that can be a little bit tricky. So if they are declared unfit for their certain position, they may need to find another type of work. And that's, again, where Retain can come in. We do work with Ohio Means Jobs and some other places that do hiring for certain companies, and we can try to help them find something new if we need to do that. In this process, the employer may request the physician to, with the patient's consent, of course, provide medical information regarding diagnoses, treatment, and prognosis. And a lot of times we hear that the patient didn't think that that was possible for their employer to ask for those things, but according to the ADA, there is a certain time where they can request it. To the end, the family physician may find it helpful to employ tools such as functional capacity evaluations and or occupational medicine consultations. So Christina, do you want to talk about how we can support someone who is unable to return to work a little more?
Yeah, we have a lot of community services that we're able to offer and resources that we can offer to patients. So as Dina had mentioned earlier, we work with Ohio Means Jobs a lot. So if a patient perhaps has lost their employment because they can no longer perform the job duties, we can connect them with Ohio Means Jobs, and from there we're able to potentially find them another job placement. But also, Ohio Means Jobs is really cool because let's just say a person has been working with maybe just a high school diploma since they've graduated, and they've always wanted to earn some type of certification or additional education. Ohio Means Jobs is able to connect these people with the resources needed to potentially offer some additional training to get them a maybe even higher paying job if needed. We also work with opportunities for Ohioans with disabilities. They're able to potentially, if a person has a long-term disability or has an injury maybe that they won't fully come to their maximum capacity with, opportunities for Ohioans with disabilities are able to find a job that will allow them to work there as well. We also offer patients who have lost health care the assistance they need to apply for that health care. And then among a million other things, we work with the 211 network who will help patients maybe who have lost their job and are struggling to make ends meet or pay their bills, connect with resources to do those. And then lastly, as we've always stated and talked about, our return to work coordinators, known as our health services coordinators, and our social workers offer tailored care to the specific patient needs. So maybe there's something very specific that we can help a patient with that they have requested, and we go ahead and all work together to get that done.
That was really good. Thanks for that rundown on the resources.
Participants in the Retain Ohio program are between the ages of 18 and 65, have been hurt outside of work, and are not currently utilizing Social Security disability insurance. To see if you qualify for the care coordination services that Retain provides, give us a call to speak with our enrollment specialist at 1-833-4-RETAIN. That's 1-833-4-RETAIN.
So some of the common prognosis factors we had talked about earlier about why someone may have a negative return to work included age, gender, the pain levels that they are experiencing, if they do have a disability, depression, previous sick leave. If someone takes off quite often, that is a factor in how soon they will return to work from a specific injury that is at hand. Their activity limits. We also are looking at participation restrictions, higher physical work demands, things like that. And these are all associated with the person returning to work also. I think that if you can get those resources that we provide, and even like you had mentioned the 211 network, some of that weight of all of that is lifted, and knowing that I'm going to get help with paying my rent, paying my utilities, possibly finding a place to live, all that can be beneficial in taking that stress off of someone's shoulders so that they can return to work. And I think more employers are asking for help with these things, especially with some employees that they would like to see come back, but maybe have just taken a turn for the worse because of their injury. They just don't have that positive attitude that they need to return. So it's one of the important components of returning to work interventions and return to work coordination. That occupational training, the conditioning, the workplace-based interventions, work accommodations, and the contact between all the various stakeholders. These are all tremendous communications that need to happen. So the important components of return to work interventions and return to work coordination, that occupational training or conditioning, workplace-based interventions, work accommodations, and the contact between the various stakeholders are all important key players in getting back to work sooner. And this is not just for musculoskeletal injuries, of course. Like I said, a lot of this has to do with mental health and making sure that you have that right mindset to get that positive attitude back before the injury even occurred. So having optimistic expectations for recovery and return to work are commonly associated with those positive return to work outcomes. And findings have produced this evidence that this is true for sure. More so even when a person has suffered a myocardial infarction or a heart attack, that can play a lot on your stress levels also. So being that cheerleader like our health service coordinators are is really important in getting that mindset to switch back into a positive mode so that people can return to work.
Yeah, and it's so important that even to date, we have seen that 80% of our patients either return to work or stay at work. So they must be doing something really great in order to help all of these people, retain employment. So early intervention and a focus on returning to work decreases sick leave and increases the likelihood of returning to work. The strategy was found best to be cost effective and improved employees' self-reported health. Employees are reporting that they have better health just by returning to work faster than they would have had they not had a return to work program. So there were three main aspects to intervention programs. The first aspect was early action and a focus on returning to work. Like Dina had just said, having that mindset really does make a difference, and having somebody there for you that helps you to focus on returning to work is a huge role that will help patients. A more central role for the case manager, which is what Retain does, we help patients by implementing the return to work coordinator to bridge that gap between employers, providers, and patients. And then the last thing is the introduction of an occupational health professional into the program. So that's what the three main aspects are for a return to work program.
And I think what even helps even more so in returning to work for patients and making it successful for them is the workplace has to have a strong commitment to health and safety, and it's demonstrated by the behaviors of the management. So when you have a manager that supports you and is there also as a cheerleader for their employees, saying, like, what do you need? How can I be of assistance to you? We're not going to let you go, or we'll make sure you have, something to come back to. And even reassuring them that somebody is helping them within their own crew to let them know that, hey, that so-and-so is stepping in for you, and, don't worry, when you come back, you're just going to start right where you left off. I think that all plays an important role.
Definitely, and the employer has to make or offer a modified or work accommodation to the injured or ill worker so that they can return to work safely and their work activities are suitable to what their current abilities are. So allowing those modifications to take place and offering a work accommodation to an employee for a period of time so that way they can still come back to work helps to have success in the return to work process.
Right. And having return to work planners on the employer side of things. So if you have a return to work planner on your team or on your staff as the employer, it shows support for that returning worker as well. And it also takes away some of the disadvantage from other coworkers and supervisors, knowing that this return to work coordinator has everything set in place for both the employee that's returning to work and the ones that are covering for that person while that person's off.
Yes, and it's important to have supervisors that are trained in work disability prevention and include them in the return to work planning. So that communication that our health services coordinators offer in that return to work plan is very beneficial to helping somebody get back to work.
Another important step is just having the employer call that patient or their employee and let them know that they are being thought of and that, we are here for you. Just a simple phone call letting them know, like, hey, how are you doing? How are you feeling? Just wanted to check in with you and make sure that you're doing okay and you don't need anything at this time.
100%. And someone has the responsibility to coordinate return to work. So we have our health services coordinators, again, who are able to reach out to the provider and say, hey, so-and-so had their first visit with you today since they've returned to work. How are they doing? And the provider might be able to say, you know what, they actually told me that they're doing even better than they thought, and they might be able to lift, 10 more additional pounds. So, and then from there, our health services coordinators are able to communicate that with the employer and let them know that our patient is able to, do a little more than we originally had thought.
And the employer and healthcare providers communicating once again. I know, like I said earlier, that doesn't happen too often where you have the provider calling the employer. So with our health services coordinator, keeping that streamlined and making sure that the employer knows what's going on with their injured employee. And again, with our patient's consent to do so, we're happy to step in and make sure that we're making sure everyone is communicating on the same page.
Yes, and lastly, I will say the worker has to have multidisciplinary resources. So these can include anything from interventions for pain management, disability, depression, and expectations for recovery. And when it's necessary, working in combination with key stakeholders, perhaps such as insurance, provider, employer, and those types of individuals, all coming together will help to increase the likelihood the patient will have a successful return to work.
So, to wrap things up, Retain basically wants to help with these statistics that we've been talking about throughout the program, helping to lower that 50% will be off work permanently after just 12 weeks off of work. We don't want to see that statistic grow. We want to see it decrease. So
yeah, and most individuals that are working individuals will agree that they need to get back to work in order to support themselves and their livelihood and their families.
right. And performing work hardening as one of the strategies to help employees return to work, I think it's really important for the provider, any occupational therapist, physical therapist, what have you, and that employer to work together. And with the health services coordinator included in that loop, I think it's a win-win for everybody. So again, if there are any patients, employees, or employers that are interested in Retain, you can call us at 1-833-4-RETAIN, that's RETAIN, and our email address.
Or you can go ahead and email us at mh-retain, retain-dept@mercy.com. If you have been injured outside of work, we'll go ahead and get your pre-screening started, as well as if you are an employer and would like to sign up to see the cool things that we offer, such as free or ergonomic assessments. Please contact us and we'll go ahead and start getting you enrolled.
Thank you, everyone, and have a great rest of your day.
Thank you for tuning in to the RETAINCares podcast today. We appreciate you all for listening. Have a wonderful evening or day wherever you may be.
Retain Ohio is funded by the U.S. Department of Labor and the Social Security Administration under a grant award to the Ohio Department of Job and Family Services. 100% of grant funding is from U.S. federal funds. The RETAINCares podcast does not necessarily reflect the views or policies of the U.S. Department of Labor or the Social Security Administration, nor does mention of trade names, commercial product, or organizations imply endorsement by the U.S. government.